The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Good evening! Magandang gabi po sa inyong lahat. Maraming salamat po sa inyong pakikinig at patuloy na pagtangkilik sa aming programa, Healthy Monday with the AAPINA of Nevada. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president and immediate past president of AAPINA and professor in nursing at Roseman University of Health Sciences College of Nursing. I hope you joined us the last Mondays for our first and second series broadcast of Anti-Asian Hate Crimes, What is Your Role? Tonight we are on our third series to address the uprising prevalence of hate crimes toward the Asian population. Thank you again, Dr. Paoli Vu from Nevada State College, who shared the history and legality related to the population. And also to Matthew Deng, who represented our younger generation from the Asian community, for sharing your advocacies related to Asian struggles and challenges. That was really a nice dialogue representing our youth. So tonight, we have a special guest who is not new to our program. In fact, he's one of ours, our current president and one of the founding members of AAPINA of Nevada. And tonight, we are focusing more on the impact on racism on our mental well-being. Dr. Ray, welcome to Healthy Mondays.
Thank you, Mary Faye. I'm so glad to be back here in your show, our show. And I'm very excited to have this dialogue with anti-hate crimes going on to our Asian community.
So our listeners out there, Dr. Reimund Serafica, or Ray, as we fondly call him, recently completed the Psychiatric Mental Health Nurse Practitioner Program at the University of Nevada in Reno. Congratulations.
Thank you.
And Dr. Ray, he has a lot to offer in regards to mental health, and we can address the impact of the recent incidents of hate crimes and violence against the Asian population. So I wanted to read some backgrounds about Ray to establish that he has a lot to offer, really. So Dr. Ray Serafica is a tenured associate professor in the School of Nursing. His research trajectory centers on acculturation as it relates to chronic disease of immigrants. His research has led to develop a new concept, dietary biculturalism, where he explores the phenomenon of unhealthy traditional food consumption by immigrants that elevates their risk of developing food-related chronic illnesses as much as when they consume an unhealthy Western diet during the post-immigration phase. Dr. Serafica earned his undergraduate and graduate studies in nursing from Gardner-Webb University and psychiatric mental health nurse practitioner from the University of Nevada, Reno. He's also a board-certified psychiatric mental health nurse practitioner. He earned his PhD or Doctor of Philosophy Nursing in Research and Education from the University of Hawaii at Manoa. Ray also is a certified nurse educator and teaches in the undergraduate, graduate, and doctoral courses at UNLV School of Nursing. Dr. Serafica serves as an associate editor of the Journal of Transcultural Nursing, and he is currently, as I mentioned, president of the Asian American Pacific Islander Nurse Association, or AAPINA of Nevada. He also chairs the faculty search committee for the School of Nursing. Wow. Okay, welcome again, Dr. Ray.
Thank you. Thank you, Mary Faye.
And would you like to add any additional information about yourself that you want our listeners to know about you?
There's really nothing special to add, but we are busy. As you know, you're on the executive committee of the Asian American Pacific Islander Nurses Association, planning for the next 2 years and doing something for the community. It's just like we kind of prioritize this topic as when we met at the the executive committee because we really think it's important for the broader, not only for the Asian Pacific Islander population, but also for other folks to hear about our sentiments and to hear the significance and meanings of this anti-hate crimes that is going on.
Mhm. Well, let me refresh the memory of our listeners out there in case they haven't heard about the three significant incidences that happened. So, there were three incidents in social media. One is a video of a 91-year-old person being violently pushed to the ground in Chinatown in Oakland, California. The second incident is another elderly 85-year-old being shoved to the ground in San Francisco. And unfortunately, this elderly later died from his injuries. And then the third one, and are just of three incidents that we're mentioning. There were others. The third one that I would mention is an incident in New York City. A 61-year-old Filipino American who was slashed in the face while riding the subway. So we really try not to think of these incidents in this modern world as anti-Asian hate crimes, but if it is not, what do you think it is? So there are these incidents. So what are your thoughts about this wave of attacks, Ray?
And I listened to Dr. View's interview, which is really fantastic, Mary Faye, from the last week's interview, and he's actually right because like we cannot really prove that these are anti-hate or hate crimes against Asians because of we cannot read the perpetrator's mind when they did the attack, and it's really hard to defend under the court of law whether that act of violence is for someone to do it because of somebody's race. You know, the 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 sad thing about this is while we are talking this, you and I and other folks, others are quiet about it. Are we being passive about it because it's not happening in our backyard yet? Or is this something that we just really don't care? And I think the call to action for the AAPINA of Nevada, we're not only asking for our nurse constituents, but the entire community to really say, enough is enough. This is something that we have to pay attention, and this is something that we can say that this is not okay. We have to do something about it. So to prove or to say that well, it's a hate crime or maybe not, but statistics don't lie. I mean, since the pandemic, it triples the number of cases against Asian Americans or even the Pacific Islander, our brothers and sisters. So this is something that it's going up, and we can't deny the fact that the victims, the majority, are people.
Yeah, we're not really sure that it's not yet happening in our backyard. As we were talking about it, I think that Pao Wu and even Matthew Dang, and now we're talking about it that it may already be happening and have been happening, and we are not aware of it because people don't talk about it.
Mhm.
Our ethnicity, our background, our cultural background, and practices and values points to being humble, being considerate with others, and that it is better to forgive. It is better to stay quiet and not make waves. But at the same time, what's happening is that the violence continues. So
Mhm.
we need to talk about it, and that's exactly why we are talking about it right here on PHLV Radio, Healthy Mondays with the AAPINA of Nevada.
And
So, as a psychiatric nurse practitioner, Ray, what do you think? I think our listeners out there, the society needs to know what is the effect of racism on mental health.
oh my gosh, I can tell you, a lot of these things, a lot of these cases that is that I've seen in practice, and sometimes you kind of like decipher like where is this stress is coming from, where is this anger is coming from, and when the client or the patient starts talking, um, their experience, their racial trauma, or they are being discriminated, actually affected their mental health conditions. And literature will show you that, racism can worsen somebody's mental health conditions. If they are already depressed, then they become more depressed. If they are already anxious, then they become more anxious. Sometimes it can also lead to PTSDs. And it can also lead to substance use disorders. They consume more cigarettes, they consume more alcohol, and we don't know where it's that coming from. But if you factor in, their exposure to those experience, then you may say that, yeah, because of racism, it kind of contributed to worsening their conditions. And also, don't forget about suicidal thoughts. We have clients in the past, or patients in the past, that because of the stress at work brought by marginalization and poor working conditions, and the verbal abuse that they get from work, because they are on a different, or they belong to a different race, then that makes the situation really hard. And when you manage this type of patients, you have to make sure that they get the appropriate, not only the medications, but also the type of therapy that will really help them to use their resiliency, and make their condition a lot better.
Yeah, from what you have mentioned, Ray, the consequences of racism affects everyone, not only the person who is experiencing, not only the victims, but all of us. Because, as you say, it affects people's productivity at work. It also the ultimate outcome of this is not so. It's a negative outcome. Someone is going to die,
Correct.
someone will take their lives, and it doesn't, when we talk about the racism, and although our series is about anti-Asian, it's not only the Asians, it's also happening to other ethnic minorities for whatever reason. Everybody have their own reason, and you mentioned earlier that we cannot perpetrate the minds of the
Of the
attackers if
Yes.
they are not verbalizing it. And Pao Vu also mentioned, like, if they didn't say anything and they just stab someone, like the latest one. I did not know about the latest one where a male Asian was stabbed from the back at
Hmm.
the subway. So we don't know what's going on with them. Maybe it's related to, as you were saying, mental health. Maybe the perpetrator or the attackers themselves are having some mental health issues, right?
Correct. Correct.
And maybe it stems from their own experiences, and we don't know. So we need to really investigate. We need to increase awareness. We need to educate people.
Mhm.
So, okay, so what are the manifestations when someone is suffering from a traumatic experience brought by racial trauma?
Yes, so it's very, very similar when a person is having a high anxiety, or even early stage of PTSD, which we normally in clinic, we diagnose them with acute stress disorder first, which a person will have to go through in a month or so before we diagnose them with PTSD, which is like more of a long term. It's happening, more than 6 months. But the common symptoms, they can be confused, they can be disoriented, sometimes, agitated. Sometimes they feel numb, they feel tired, they cannot concentrate, and everything that surrounds them that reminds them of the situation will trigger that effect, so they have to go back to that experience. And what happens is like, their level of functioning suffers. They cannot work, they cannot manage their family, they cannot even feed their children anymore because of this. So it's really a mental debilitating conditions that they have to go through. And of course, once they are already on the PTSD stage, then you have those vivid dreams, those violent dreams that sometimes they even hallucinate. They hear voices. They have some visual hallucination that goes with it. And that becomes more complex when a person is already depressed, and when a person is already having those anxiety, plus you add another diagnosis of acute stress disorder or PTSD because of racial trauma that they experience.
And the fear of it happening again. So imagine if you were like, I'm really curious about how that 61-year-old male, Filipino male, is feeling right now. Is he is still able to ride the subway, or is probably always looking behind him, or if someone's staring at him, he's probably fearful that it's going to happen again, right?
Correct. And I was just like reading some of the blogs in social media. I'm not really a big fan of blogs in social media, but then when I'm researching about the topic, I came across about this woman who was recently, she was in New York riding the subway, and someone even pulled her mask out of her face and spit on her and calling her names, derogatory names, with Asian connotations. So that alone, and we're not only talking of physical violence that's happening in some of these folks, but the verbal abuse of people can really affect someone's mental health conditions. And if I may, Mary Faye, I'm going to read one of these uh, entry in the blog, and this was written by, I think, Michelle Kim, one of the Asian American bloggers, and this happened to her like years ago. But then, since we have all this happening again, the numbers are going up so much. She decided to share her experience that happened to their family. So she said, a few years ago, my Korean mom, who only knows to smile when someone looks at her, was held at a gunpoint, robbed and punched in the head by a black man in San Francisco. She did not want me to worry, so before calling me, she called the police. Beyond filing a routine report, they did not offer any material support that could help her heal from the trauma. She was left to her own devices to figure out how to process her physical and emotional trauma, earn back the rent money she had lost, and protect herself against identity theft. Thinking about that night and seeing the ongoing violent attacks on other Asian elders, I wake up wailing from the pain, even desiring to inflict physical harm on these perpetrators who remind me of what happened to my sweet mom. But what I'm trying to tend to is undeniable fears and aggressive love I have for my people that is stronger than my desire for punishment for those who harm us. That more than I want to hurt them back, I want to keep our people safe, not just now, but for good. So that is really a powerful entry that she did on her blog, and that happens like years ago, but then it came back to her, and to see her coming out of that, and her mom, I hope she's fine. That is something that will scar you for life. I just can't imagine if that happens to my mom or somebody that we know who's elder, and being attacked. And some of these situations now or incidents, it's even unprovoked. They said it's unprovoked incident. There's no exchange of hates or whatever. They just come and get you in a way that you will feel physically, or you will have that experience that you have been physically attacked or mentally attacked.
Her blog has a lot. As I was listening to her blog, there's a lot of emotions
There
in her
is.
blog. And what stood out for me are three things: the pain, the pain of she was not there when it happened, but the report probably, good job, mom, that she went to the police and reported it. And that's exactly what Pao Vu was talking about. Like, we can talk about it on the blog and everything, but if it is not recorded in the legal system, then it's just another incident. It was not identified as it is. I fear her. I felt her anger. I felt her pain for her mom. I felt her anger. And then most importantly, her thoughts of revenge.
Correct.
So it's going to be, if we don't talk about it and if we don't sort this out and look at what can we do to prevent it. And revenge is the first thing that those who are involved or the loved ones are the victims. That's what you want to do. You want to do it back to them. And that is so much against our upbringing, that says, do unto others what you would like others to unto you. Right.
Yes.
So I think it's very important for us to educate and talk about our emotions so then we can address it. And so we can do the right thing. We always wanted to do the right thing, because if she did take a revenge on those people, maybe they also have a mother and then she does the same thing, that it's a vicious cycle.
Mhm. Correct. And again, if we have to go back to the model minority, the Asians have been called the model minority because, number one, we are hardworking, we are always politically silent, and we are well-behaved immigrants. I mean, we kind of like do what we need to do to feed our family, to send our children to the best schools. But then again, there's also a negative consequences of that, because when we are being attacked or when we are violated, then nobody's paying attention. I'm kind of like frustrated right now, even though we have some news about social media. They will mention about another attack on Asian elders, another attack in the subway. But are we doing enough? Are we giving, or are they providing us the same exposure that they had when Black Lives Matter started? That's something that probably, that's why we're not getting so much help right now, because they think, the higher up thinks that we're doing okay. We're very resilient about it, and we're not really talking about it. So I'm glad that even for the blogs, there are some out there already starting, but I really want to see more Asian or Pacific Islander folks, stepping up and talking about it, and nurse educators, put it in your curriculum, put it in your case studies, put it in your simulation. So that will bring all this, to this stage where we at right now, that this is not okay, and this is what we need to do about it.
Let's talk about it. Incorporate it in your lesson plan. Maybe do a debate. Pros and cons. And why it's happening. And I think our nursing students need to know about what can we do, even as nursing students. What can I do to help prevent this from happening? what can I do to educate the public about this is not okay? And what can I do to increase awareness that if even if the Asians are not talking about it, we're still hurt, we're still angry about it, and we could have a tendency to take revenge on those, on those perpetrators. So I think that our the stereotyping again, and we talked about it during the first series and then the second series. Now we're also talking about it here that we are stereotyped as timid, and we're stereotyped as humble, and we won't make waves. And the younger generation and those who are just fed up about this, and when they speak up, we are now labeled as rebels, because
Right.
we are acting outside of what they had stereotyped as to be.
And
And they don't think that's normal for us to do that.
correct, Marife. And there's always that stigma for Asian Americans, especially to be like we are branded like passive aggressive because we are just like quiet and we don't say anything until that frustration and anger build up and we'll just walk away from the situation. I remember the late Dr. Sue, who was once he was a faculty of UNLV. He called that the point of no return, like you just and he warned us as Asian faculty at the time that you don't say something now, then when are you going to say it? You're just going to say it by the time you resign, or by the time your angry level is up here, then only you have this big outburst, and they label you, a person who is suffering from a mental health disorder or something like that. But it's good that you brought up, finding the support from friends, from network, from family or community. Very, very important. Talk openly about racism, and those who shared identity can help people work through their feelings of stress, frustration, and anger. And having that support network that can help people manage mental health conditions as depression, or by reducing isolation and encouraging hope. So this is not the time to be fearful, as you say, and you say, oh no, because there's too many incidents out there, then I'm not going to work anymore. I'm not going to school anymore. I fear for my life and for my family. I'm not going to do the normal things that I need to do. We need to continue doing what we are doing. We just need to be cautious. If let's say you like to walk around the block for your exercise, maybe this time around, bring somebody with you, or you walk in groups or things like that. There are many things that we can still protect ourselves. This is just like another pandemic, that as long as we are wearing our masks and doing all our hand washing and social distancing, we can say that we can still function like what we used to be before these numbers went up. So yes, very, very important. And also to recognize, if a person is already suffering from this type of mental distress. So this is what nurses do. We have to be aware and we have to be vigilant of people around us, people that we work with, or people who are living with us. Again, just by being so quiet, they may not probably share their experience that they have been attacked, either physically or mentally, or or verbally, I should say. Then we don't know. And they develop all these symptoms. They develop all these somatic symptoms. So this is the time that we really need to take care of each other.
Yeah, I think creating a safe environment so that they will eventually talk about it. I think that this is same as what you were saying about any trauma, racial trauma is also uh, representing all the signs and symptoms of that, the post-traumatic stress syndrome,
Mhm.
and then that created that fear. And if they are like, that's why uh, I was wondering how that Filipino male is doing right now, if he's still riding the subway, going to where he needs to be. And it's sad because then it stops the very life of the person.
Correct.
And yeah, and then it affects everybody. And if he has a family and he start having fear and not being able to do his what we call activities of daily life,
Mhm.
then this person's life has been destroyed. If he doesn't, end up taking his life, then his life is destroyed because he's no longer able to do his normal activities. So it's good to talk about it. We can't just be quiet about it. If it happens to you, just like the blogger's mom, she went straight to the police and reported it. So there's so many ways that we can help this population who's affected by the hate crimes. I think you mentioned already what you do when someone is suffering from emotional distress related to racism and racial trauma. Any additional insights, Ray, with your practice?
Yeah. So when someone and even a registered nurse can always advise somebody who's going through racial trauma, for example, even if it's not if the person is not being physically violated, but if it's verbally violated, then you can really say that that person's stress level uh, is going up. So we learn in nursing school, like to relieve stress, breathing exercise, mindfulness or meditation, physical exercise. You increase your physical activity, or maybe create a new hobby or something like that. And guess what, guys? Those still works even for now. But then when it becomes a little bit more serious, when the person complains about having flashbacks, when the person complains about having nightmares, when the person complains about headaches, palpitations, or avoidance of the activity that will lead to another trauma, like I will not use the subway anymore because I'm afraid that that will happen again. Or there's always a constant feeling of alertness or being so hyper arousal, we call it, or hyper vigilant about any of the situation, then we need to advise the person to really seek a professional help. And so that person can start, if they need medications, if they need therapy, then they can be on that regimen to help them. Because again, as you said, Mary Faye, this person may just like take it all in and will just like go on until their cup runs out or overflow, and then they will create their own violence against others, and we don't want that to happen, or emotional breakdown, or they will just like commit suicide, with a series of suicidal thoughts that they have been experiencing in the past because of the attack, or culminating experiences against being racially discriminated. Um, we really need to reach out and see what we can offer as nurses to these folks.
Yeah, those are the worst complications of racial trauma and emotional distress related to racism. And I was just thinking about um, how some stories, and even in the movies or in on TV, when they show a character on any show on TV where the Asian is being beat up by even in the school setting, and this young boy is being beaten up by the other classmate, and no one stops them.
Mhm.
No one tries to say, hey, that's wrong. Or no one's that, because they are afraid that they will turn to them. So I think that if someone says something to stop it from happening, we are like reacting to the situation after it happened. And I wish that there is some way that we can educate and implement where we can actually do prevention. Call it as it is when it happens. Don't be afraid, right?
Correct. And with that, you being you said that we really need to confront racism. This is the best time to do it, making the invisible visible, such as by pointing out the false assumptions in someone's statements. I know, I think Dr. View talks a little bit about microaggressions too in the past, those implicit biases, that can lead to a much bigger situations if we don't pay attention to what's going on in a workplace, or even in grocery stores, or where we at. Disarming the microaggressions, such as by asking the persons to speak to them privately, and educating the person on why their words and action are harmful, and it can affect, if, and they always say, well, he's fine, she's fine, she did not die. Yeah, but then the verbal abuse that that person took from somebody else, that will scar them for life. That will cause a lot of these somatic symptoms, this emotional distress that will affect, their overall mental health conditions.
I think a lot of organizations now are addressing this increasing racial discrimination. I say that because here locally in the Valley, here in Southern Nevada, and I can speak of Roseman University of Health Sciences, we have now a diversity, inclusion, and equality committee. And I know that Nevada State College has, because Dr. Pao Wu is the director for their diversity. And in the coming series, we are inviting Dr. Cheryl Brewster from Roseman University, who is our senior executive dean for diversity and inclusion and equality. So you're going to hear from a different ethnic background and what they think about what's happening. And I think that's very important to hear what other people are saying. We have invited Asian representative, but now, let's hear in the near future, what the other ethnic minority feels about it.
Mhm.
Wow, Ray, time flies when we're having fun.
Wow.
Any last words of wisdom to our listeners out there regarding our topic?
Well, as we talk about this, Mary Faye, and I really want to thank you and PHLB Radio for making a series out of this. I think this is very timely. This is really important. We really need to understand racism, has how they impact mental health. In a variety of ways. It may cause or worsen a number of mental health conditions. That's like what I mentioned in the past. It can also cause racial trauma, which affect both the individuals, their families, and even the larger community. So I always advise people to seek support from people who understand what it's like to have that experience, to experience racism. It may help or reduce the negative impact to somebody's mental health. For our nurses, our nursing students, pay attention to the people around you. If they have been suffering from emotional distress brought by racism, then you know how to help them. You know where and how to refer them to seek professional help.
Thank you again, Dr. Ray Serafica, for being our special guest tonight. And of course, thank you to our listeners out there for joining us tonight. Please continue to join us. And also, I would like to say a special thanks to our community partner, PHLB Radio, for allowing us to broadcast this important information to our listeners out there. So remember, listeners, every Monday, is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.